Have you ever felt your heart suddenly flutter, pound, or skip a beat? One moment you're fine, and the next your heart feels like it's sending Morse code. Heart palpitations affect millions every year. They can strike during stress, exercise, or even while resting. In this video, we'll break down heart palpitations, their causes, and red flags. So what exactly are heart palpitations? In simplest terms, they're sensations where you become acutely aware of your heartbeat. It might feel like your heart is pounding, fluttering, skipping beats, or even beating too hard or too fast. Many palpitations are completely benign. However, in some cases, these palpitations can be a sign of underlying issues like arrhythmias, electrolyte imbalances, or even heart disease. The important thing to remember is that knowledge is power. One of the trickiest things about palpitations is that they can feel different for everyone. Some people say it feels like their heart is doing somersaults in their chest, while others describe it as a skipped beat followed by a really strong thump. These sensations can last anywhere from a few seconds to several minutes, and they might pop up randomly or in clusters. Let's talk about what might be causing these heart-racing moments. Stress and anxiety are common triggers. They release adrenaline, sending your heart into overdrive. Caffeine and energy drinks give your heart a jolt. Nicotine and drugs can mess with your heart's rhythm. Exercise can cause temporary palpitations. Lack of sleep, hormonal changes, and medications play a role. Electrolyte imbalances can trigger palpitations. Not all palpitations are a reason to worry. Stress can send your heart racing. After a workout, your heart might beat faster. Sleeping on your left side can make your heartbeat more noticeable. After a big meal, blood flow increases, affecting heart rhythm. Infrequent short palpitations without other symptoms are likely harmless. While many instances are benign, there are times when they could be red flags for underlying health conditions. Remember those arrhythmias we mentioned earlier? These abnormal heart rhythms can sometimes manifest as palpitations. Conditions like atrial fibrillation, supraventricular tachycardia, and ventricular tachycardia can all cause irregularities in your heartbeat. Palpitations can also be associated with heart valve issues, an overactive thyroid, or even coronary artery disease. It's important to be aware of these possibilities. If you experience any of the following symptoms along with palpitations, it's crucial that you seek medical attention immediately. These could be signs of a life-threatening arrhythmia, a heart attack, or another cardiovascular emergency. Warning signs include chest pain or pressure, shortness of breath, dizziness or fainting, confusion, bluish lips or skin, extreme fatigue, and a heart rate over 120 beats per minute at rest. It's always better to err on the side of caution when it comes to your heart health. Let's say you've been experiencing palpitations and you're understandably concerned. What can you expect when you go to the doctor? They'll get a thorough understanding of your medical history and perform a physical examination. This includes asking about your family history of heart conditions, any medications you're taking, your caffeine intake, stress levels, and other relevant lifestyle factors. When you're feeling anxious or panicked, your body releases a surge of adrenaline, that fight or flight response. This adrenaline rush can cause your heart to race, skip beats, or even feel like it's fluttering or tightening in your chest. Panic attacks often mimic the symptoms of a heart attack, which can be incredibly frightening. While panic attacks themselves aren't dangerous to your physical health, chronic stress and anxiety can take a toll on your heart over time. Many lifestyle factors can directly impact your heart rhythm, and the best part is, these are things you can change. Caffeine and alcohol can definitely send your heart into overdrive. Aim to limit your caffeine intake to less than 200 milligrams per day, and be mindful of your alcohol consumption. Staying properly hydrated is crucial for overall health, and it plays a significant role in regulating your heartbeat. When you're dehydrated, your blood volume decreases, forcing your heart to work harder to pump blood throughout your body. Aim to drink plenty of water throughout the day. Palpitations themselves aren't a disease, but rather a symptom of an underlying issue. One of the most common culprits is thyroid disease, particularly an overactive thyroid, also known as hyperthyroidism. Another common culprit is anemia, a condition where your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. This can cause your heart to work harder to compensate, leading to palpitations. Certain medications and substances can actually trigger heart palpitations. Over-the-counter decongestants that contain pseudoephedrine are notorious for causing palpitations, especially in people who are sensitive to stimulants. Asthma inhalers, specifically those that contain beta agonists, can also have a similar effect. If you're taking thyroid medications, be aware that they can sometimes cause palpitations, especially if your dosage is too high. Hormonal fluctuations, especially those that occur during major life stages like pregnancy, menopause, and perimenopause, can definitely influence your heart rhythm. Estrogen and progesterone affect how your body handles stress, electrolytes, and even your cardiovascular system. During pregnancy, your blood volume increases significantly to support your growing baby. This puts extra strain on your heart, which has to work harder to pump that extra blood throughout your body. Amazing technology helps us monitor our health, including heart rhythm. Smartwatches and fitness trackers are popular for tracking heart rhythm. Devices like Apple Watch, Fitbit, and Garmin track your BPM. Some detect irregular rhythms and alert you. Blood pressure monitors with pulse readings are another option. Depending on your individual situation, your doctor may recommend a series of tests to get a clearer picture of what's going on with your heart. The electrocardiogram, or EKG, is a painless test that records your heart's electrical activity. It's often the first line of defense in diagnosing heart rhythm problems. If your palpitations are intermittent and don't show up on a standard EKG, a Holter monitor can record your heart's electrical activity continuously for 24 to 48 hours. The best course of treatment for your palpitations will depend on the underlying cause, the severity of your symptoms, and your overall health status. For many people, simple lifestyle adjustments are enough to significantly reduce or even eliminate their palpitations. Limiting caffeine and alcohol, staying hydrated, managing stress, and getting enough sleep can make a world of difference. These lifestyle factors can make a world of difference. When it comes to heart health, an ounce of prevention is truly worth a pound of cure. Many of the things you can do to prevent heart palpitations are also great for your overall health and well-being. It's all about making small, sustainable changes to your daily routine that add up to big results over time. Aim to limit your caffeine intake to less than 200 milligrams per day, and remember that caffeine isn't just in coffee, it's also in tea, chocolate, soda, and some over-the-counter medications. In simplest terms, an arrhythmia is any abnormality in your heart's rhythm. It could mean your heart is beating too fast, which we call tachycardia, too slow, known as bradycardia, or with an irregular pattern. Not all arrhythmias are created equal. Some are completely harmless and don't require any treatment, while others can be serious and even life-threatening. Atrial fibrillation, or AFib as it's often called, is the most common type of heart arrhythmia, and it's a frequent culprit behind those pesky heart palpitations. AFib is characterized by a rapid and irregular heart rhythm that originates in the atria, the upper chambers of your heart. Instead of beating effectively, the atria quiver or twitch, causing blood to pool and increasing the risk of blood clots. Let's wrap things up by addressing some frequently asked questions about heart palpitations. Can dehydration cause palpitations? The answer is a resounding yes. When you're dehydrated, your blood volume decreases, making it thicker and more difficult for your heart to pump. This can lead to a faster heart rate and even trigger palpitations. As we wrap up this deep dive into the world of heart palpitations, I want to leave you with one final thought. Your heart is more than just a pump. It's a storyteller. Most palpitations are completely harmless, especially those occasional flutters that come and go without any other symptoms. Listen to your body, be aware of the warning signs, and don't hesitate to reach out to your doctor if you have any concerns. So the next time you feel your heart doing a little dance in your chest, take a deep breath and remember what we talked about today. Not all palpitations are created equal. Remember, you are your own best advocate when it comes to your health. And as always, stay happy and healthy.